Today, I want to talk to you about something you have probably experienced before. That annoying sensation of having phlegm stuck in your throat, that constant urge to clear it, to cough, or to scratch your voice. We have all been through that at some point. A small amount of mucus is normal, of course. Our body produces mucus as a natural defense mechanism designed to trap dust, bacteria, or viruses. But when phlegm becomes thick, excessive, and persistent, it may be a sign that something is not quite right. In this guide, we are going to uncover the four most common causes of persistent phlegm in the throat. I will explain how to identify them and, more importantly, what you can do to reduce the problem and feel much better. Stay with me until the end, because I will also share 5 very effective natural remedies that you can start using today. Cause 1. Gastroesophageal reflux. The first cause we will look at is gastroesophageal reflux, or GERD. Imagine your stomach as a pot with a lid. That lid is a valve called the lower esophageal sphincter. It opens to let food pass and closes to keep stomach acids from rising. In reflux, that valve does not close properly. Stomach acid rises through the esophagus and in some cases even reaches the throat. When this happens, it irritates the membranes of the throat and causes inflammation. As a defense, the body produces more mucus, what we feel as persistent phlegm. Interestingly, many people with reflux do not feel classic heartburn, but they do notice constant throat irritation, a nagging cough, or a hoarse voice. In people over 50, reflux can sometimes appear not because of too much acid, but because of too little. When acid production decreases, the valve mistakenly assumes there is no risk, and it remains slightly open, allowing acid to travel upward more easily. Signs your phlegm might be caused by reflux include a burning sensation in the chest or throat, especially after eating, food that seems to get stuck in the throat, regurgitation of liquids or food into the mouth, persistent coughing, especially at night, a hoarse or raspy voice. What you can do at home: avoid heavy meals before going to bed. Reduce foods that worsen reflux. Fatty foods, citrus, chocolate, coffee, or alcohol. Elevate the head of your bed about 6 inches, 15 centimeters. Try soothing herbal teas such as ginger tea. Ask your doctor about diluted apple cider vinegar, which may help balance stomach pH. Cause 2. Chronic sinusitis. The second cause is chronic sinusitis. We all have air-filled cavities in our face, located around the eyes, nose, and forehead, called paranasal sinuses. These cavities normally produce mucus to trap bacteria, viruses, and particles. When the sinuses become inflamed, mucus production increases. If that mucus does not drain correctly, it drips down the back of the throat. This is called postnasal drip, and it leads to constant throat clearing, coughing, and that sticky phlegm sensation. Common causes of chronic sinusitis include poorly treated infections that become persistent, nasal polyps, which are small growths that block mucus drainage, a deviated septum that prevents proper airflow and mucus clearance. Symptoms to watch for: nasal congestion that lasts for weeks or months, pain or pressure in the face, especially around the eyes, forehead, or cheeks, which worsens when leaning forward, bad breath, partial loss of smell, fever, fatigue, or general discomfort if the cause is infectious. What to do? Stay well hydrated to thin mucus and help it drain. Use saline nasal rinses to clean the sinuses. Try steam inhalation to open airways. Consult a doctor if the problem persists to rule out infection, polyps, or a deviated septum. Cause 3. Allergies. The third cause is allergies. Here the problem is not bacteria or viruses. Instead, your immune system, normally your body's protector, overreacts to harmless substances such as pollen, dust, or mites. When that happens, the body releases histamine and other inflammatory chemicals. This stimulates excess mucus production, which becomes thick and sticky, getting trapped in the throat. Signs: it could be allergies. Phlegm that appears only at certain times of year, such as spring or fall. Sneezing, itchy eyes, or nasal congestion. Symptoms that worsen in certain places or environments. What to do? Identify and avoid the allergen, pollen, dust mites, or pet dander. Keep windows closed during pollen seasons. Use air purifiers at home. Wash bedding in hot water and use anti-dust mite covers. Keep rooms well ventilated. Consult a doctor if the allergy is severe. Because 4, respiratory infections. The fourth cause is respiratory infections, whether viral or bacterial. When a virus or bacteria enters our airways, the body responds by inflaming the mucous membranes of the nose, throat, and bronchi. This triggers increased mucus production, which traps germs and helps expel them. Normally, mild infections resolve on their own in a few days, but you must pay attention to warning signs. Yellowish or greenish phlegm, high fever, chest pain, or difficulty breathing. If any of these appear, seek medical care immediately. Natural remedies to eliminate phlegm. Now that we understand the causes, let's look at 5 natural remedies that can help. 1. Hydration. Drinking enough water keeps mucus thinner and easier to expel. It also helps the cilia, the tiny hair-like structures in your airways, move mucus outward more effectively. 2. Herbal teas. Certain herbs have mucolytic and expectorant properties. Thyme helps dissolve thick mucus and makes coughing more productive. Mint refreshes, decongests, and soothes the throat. Ginger, anti-inflammatory, reduces swelling of the mucous membranes. Garlic strengthens the immune system with allicin, a compound with antibacterial and antiviral properties. 3. Humidify your environment. Dry air irritates the throat and increases mucus production. Use humidifiers to keep humidity between 40 to 50%, or place a basket with damp towels in your room. 4. Nasal rinses and steam. Saline nasal rinses clear the sinuses and make mucus easier to expel. Steam inhalation opens airways and softens the mucosa. 5. Avoid irritants. Smoke, dust, pollution, and certain chemicals increase mucus production. Avoid these irritants whenever possible. In summary, persistent phlegm in the throat can be bothersome, but in most cases it has an identifiable cause. Gastroesophageal reflux, chronic sinusitis, allergies, respiratory infections. With simple habits and natural remedies, we can reduce phlegm and improve our quality of life. Remember, always pay attention to warning signs such as high fever, chest pain, or difficulty breathing. And above all, stay hydrated, take care of your diet, breathe clean air, and consult your doctor when necessary. This way, your throat can feel free and comfortable again, and your voice can remain clear and strong. If you found this video helpful, click like so more people can see it. Subscribe to receive more health tips that can change your life. Take good care of yourself, and I'll see you in the next video.